The road to health is a two-way street, and healthy communication with your doctor and other healthcare professionals can prevent traffic jams, close calls, and even accidents. You can learn more about preparing for your medical visit and communicating during an appointment in the previous videos in this series. This video can help you understand diagnosis and treatment plans. Understanding your diagnosis and next steps can be a challenge. It might help to bring something to your appointment to take your own notes with, or to try to put the diagnosis and treatment into your own words. Your provider should talk to you about doses and instructions for taking medications. You should also get written instructions and information about your diagnosis and any treatment plan. If not, you can ask for it. Having something written down to refer to later can help your treatment succeed.
Any of us as human beings, it's very hard for us to admit when we don't know something or don't understand something, and that's natural, and all of us feel that way. I try very hard to make my patients feel comfortable so that they feel comfortable asking questions no matter how dumb they think the question is. There's no such thing as a dumb question in the doctor's office. During the appointments, usually when I'm explaining a condition or a treatment to a patient, I make the effort to ask them if they understand and try to get them to ask any questions, give them opportunities to ask questions. After they go home, we tell patients to call us with questions or email us with questions whenever possible.
Ask at any point. So they ask their doctor, but if they get out before they, at the receptionist desk, if the question comes up again, they talk to the clinic nurse. And if they're then in the pharmacy and then there was another question that they forgot to ask the physician or the clinic nurse, then they ask the pharmacist because it's about the medication and they may be able to answer it. But the key thing is to get the answers to the questions that are really important rather than being afraid to ask those questions. Questions really help us also as healthcare providers, because sometimes we think that we're really doing a really good job of explaining something, and when you ask questions, it helps us know, oh wow, I totally missed the boat there. I thought that I was really giving a straightforward, clear explanation of what was going on or what the diagnosis was or what the treatment was, and it was very clear in my mind, but obviously if you still had a question about it, there was something else that I needed to give, additional information that I needed to provide to you so that you would be able to understand it and be able to take that information and use it proactively to help optimize your health.
More and more healthcare providers are using electronic health records to track and report patient health, so ask whether your records are available electronically and how to access them. This can help you track test results, future appointments, diagnoses, treatment plans, and even medications.
It's an important advance. It allows documentation and, more importantly, probably some consistency of documentation among providers. And it's going to allow us to collect a lot of data and I think ultimately learn how to use that data to better provide care for patients.
Healthcare professionals that you feel comfortable with and who understand your values will help you achieve your health goals. But communicating well requires attention and effort on both sides of the street. Learning how to talk to your medical team can improve your overall healthcare experience and in turn make the road to good health a whole lot smoother.